Greetings, everyone, distinguished participants. It gives me a great pleasure today to be welcoming you to this virtual global summit on vaccine demand. I'm also honored to be co-hosting this session today with Honourable Minister Sajan, the Minister for International Development for Canada, as well as with UNICEF. We're very hopeful today's summit will bring a lot of experiences to help us bring more global commitment and momentum to push the global vaccine demand and rollouts, reaching vulnerable communities in our countries. I will share briefly our experience in Ethiopia in terms of vaccine rollout for COVID. We started rolling out the COVID vaccine in March 2021 when we started implementing it in a very stringent manner, prioritizing those most vulnerable, particularly healthcare workers, those older age groups, and with chronic illnesses. In the first few months, particularly from March to November 2021, using our primary healthcare system, we were able to vaccinate around 5.1 million people. So the progress was not as we expected, particularly, of course, compounded by the supply challenge. But even after the supply issues were improved, we were still not progressing much. So we had to sit and decide what other approach we should use, and that's when we first launched the campaign in December 2021. With our first campaign, we were able to vaccinate 6.1 million doses, and then building on this and getting the learnings, we continued with our second and third campaign. Currently, we are undertaking our third campaign, and as we speak, we have rolled out 49 million doses overall, of which the total population at least vaccinated once is around 4.6 million people, and 34.7 million people have been fully vaccinated. So this has been a huge progress, and this was possible due to many reasons. One is, of course, through these campaigns, we had extensive communication and advocacy up to the lowest village level, and this was supported through media and social media communications advocacy. There was extensive supply and logistic support, which was enabling to reach communities closer to bringing the vaccine closer to communities using our outreach teams. And of course, this was also possible because of a strong political commitment, leaders engaging at different levels in this campaign, and also the stakeholder commitment. We are engaging civil societies, religious institutions and religious councils and other communities in helping us move forward. We are also focused on reaching more vulnerable communities like IDPs and refugees and those in more congregated settings as well. And this has really helped our progress. But this would not have been possible without the support of our global partners. The vaccine, availing the vaccine was being done through the COVAX facility, through bilateral support from governments, and then the delivery support was supported by World Bank and also the COVAX through the COVID delivery partnership. And this support was really instrumental in really achieving these progresses, and the extensive support of the development partners on the ground together with us, particularly supporting logistics, including several car rentals, which helped enhance our national supply chain system. So although it was a challenging process, with all these coordinated efforts, it was possible to really achieve a lot, and I hope this experience sharing will help us also move forward in other countries. And this has not just supported the delivery of the vaccines, it was also at the same time supporting our systems, particularly our supply chain management systems. So I hope we'll have really excellent time and discussion, and my apologies that I'm not able to join this live, but my colleague has joined here to answer any questions that may arise. And I wish us all a fruitful session. Thank you.